study is part of an ongoing study that we have looking at treatments for autoimmune diseases in pregnancy and outcomes for the children. And the rationale for doing this particular analysis is there's been a question since the launch of biologic medications for treatment of rheumatoid arthritis and other autoimmune conditions. When used in pregnancy, if the use of these medications may actually interfere with normal immune function in the infant after birth. And so we wanted to try to address the question of whether or not there is a higher incidence of serious infections in these infants if the mother's used a biologic during pregnancy. So we looked at both use of any biologic in pregnancy and use of a biologic in the third trimester when hypothetically it's thought that at least some of these medications may have the capability of crossing the placenta. And we compared those women who used a biologic anytime or in the third trimester to women who had the same underlying condition, rheumatoid arthritis, but hadn't used a biologic anytime in pregnancy, and to women who didn't have one of these conditions. And we found low rates of incidence of serious or opportunistic infections in all three groups, and we found no significant differences between the groups. I think the implications are that this adds to kind of the mounting evidence that is reassuring for use of these medications when needed in pregnancy. Certainly we need more data, and we would like to have other samples that address the same question, and we would like to be able to have information on direct measures of immune function in the children. But to the extent that these data at least tell us that we don't see any evidence of a big increased risk of these serious infections, I think it's reassuring. So there are certainly measures that can be taken to look at the child's immune response in various settings. One of the ones that we're engaging in now is when we do this one-year follow-up for infants, as they get past the 6-month mark and they no longer have high levels of passive immunity from the mother, and they have hopefully had the series of recommended vaccinations, we are now starting to look at vaccine titers. So are they responding appropriately to vaccines? So that would be one direct measure of immune function. Our studies are continuing ongoing. We've added another 3 new medications this year. So we'll continue to look at new medications as they come on board in terms of their safety. And in terms of long-term follow-up, we are now starting in many of our studies to look at these children born to mothers with a variety of different treatments in terms of neurodevelopment and growth up to 5 years of age. So we think that this is also an incredibly important endpoint that parents care about and clinicians want to feel comfortable about.